Good day to all. In today's video, let's discuss about cell injury and causes of cell injury. So, cell injury can be caused due to cellular stress. So, when the cell experiences stress, it tries to overcome the stress by doing adaptation. So, there are many types of adaptation. It will try to overcome the stress. But when the cell cannot able to adopt the stress, then it leads to cell injury. So cell injury is a term used to describe any type of damage or harm that occurs to the cell. So there are two types of cell injury. It is irreversible cell injury and reversible cell injury. Irreversible cell injury. So this type of cell injury is that when the cell cannot able to adapt the stress, it leads to injury that cannot be able to set back to the normal condition. So irreversible is the cell damage which is ultimately going to lead to death of the cell. So it might be necrosis. Necrosis is nothing but a type of cell death that is characterized by the destruction of the cell membrane and the release of intracellular contents. So apoptosis, so it is a programmed form of cell death that is characterized by the orderly dismantling of the cell. And oxidative stress occurs when cells are exposed to an excess of reactive oxygen species which can damage DNA, proteins and lipids. So if the damage is too severe, the cell may be unable to repair it and may lead to cell death. Autophagy, and since autophagy is a process by which cell breaks down and recycle their own damaged or unnecessary compounds. So the damaged cell will be keep on multiplying or proliferating. Ischemia. Ischemia is a type of cell injury that occurs when blood flow to a particular cell or to the particular area is reduced or cut off completely or partially. So this can be caused due to the variety of factors including any blockage in the blood vessel or any trauma or any ischemic cell injury that can lead to a cell death because of the blood flow. So hypoxia is a type of cell injury that occurs when the cell is not getting an adequate amount of oxygen. So even though blood flow is not necessary compromised here, it can be caused by the variety of factors including anemia, high altitude or any lung disorder. So the main reason of this type of cell injury is due to the lack of oxygen supply to the cell. And next is reversible cell injury. So reversible cell injury is a type of cell damage uh, where there could be a repair of the cell and get back to the normal condition in most of the cases. So it might be swelling or lipid accumulation and so on. So swelling is a common response to cell injury and occurs when cell accumulates excess fluid. So this can be caused by the variety of factors including inflammation, toxic substance or maybe due to hypoxia. Swelling can lead to cell damage if it is prolonged or if it causes any increase in intracellular pressure. So if anyhow the swelling can be reversible. So lipid accumulation occurs when cell accumulates excess lipid which can be seen as vascules or droplet within the cell. So this can be caused due to the variety of factors including any chemical substance or hormones imbalance or due to the metabolic disorders also. Cause of cell injury. So the cell can lead to changes in the cell and cell can able to experience a stress due to maybe external or internal changes, and the organelles that are responsible for these stress are mitochondria, endoplasmic reticulum, nucleus and plasma membrane. So causes like physical damage, like trauma, radiation, heat, and this can include things like mechanical stress or extreme temperature or even radiation, and oxygen deprivation, like cell need oxygen to survive for a proper function. So when oxygen level are too low, it can lead to cell injury and cell death. So chemical damage, this can be caused by exposure to toxic chemicals or drugs which can disrupt the normal function of the cell. So biological damage this can caused might be due to the infections, inflammations, or autoimmune reactions which can damage or destroy the cells. Aging is also another factor that is natural process that is characterized by a decline in the function and repair of the cell and tissue, and also the nutrient imbalance. When cell need a balance of nutrients in order to function properly. So when there is an imbalance in the nutrients, it can also lead to cell damage. So the medications for this is anti-inflammatory drugs. These medications can help to reduce inflammation, swelling, and any associated pain with cell injury. Antioxidant. So medications such as vitamin C, vitamin E can help to reduce the oxidative stress and protect cell from the further injury. So immunosuppressant, these medications can help to suppress the immune system and reduce inflammation in case of autoimmune cell injury. And stem cell therapy. So this treatment involve the injection or infusion of stem cells, which are undifferentiated cells that have the ability to develop into many different types of cells. So stem cell therapy may be used to treat cell injury in a variety of organs and tissues. Thank you.